Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit my playlist. In the playlist I have provided almost all the topics so far discussed in a very systematic order. So it is quite convenient for the study and I hope you make use of it. So friends, we were discussing about the analysis of the dosha. In the last class we have seen dosha analysis when we are prescribing any medya rasayana or medya drug to the child. So today we will see what are the points that you have to keep in mind with respect to dosha when you are dealing with any of the chronic disorders. Now most of the time the chronic disorders are very common in Ayurveda practice and we need to know that when we are dealing with such chronic disorders, what are some of the important aspects that we have to keep in our mind? Number one, in any chronic disorder, when you give the kashaya rasa, okay, kashaya rasa preparations, maybe some of the kwatas or whatever, kashaya rasa preparations, we know that the kashaya rasa will go into pacify both pitta and as well as kapha. Okay, the kashaya rasa will go into pacify both pitta and as well as kapha. But we should also remember that kashaya rasa is vata prakopaka. Okay, although it is pitta and kapha hara, meantime it is also vata prakopaka. So when you are dealing with a pitta and kapha, that means in a pitta and kapha associated doshas, if vata is kshina, then it can be given to treat this disease. I hope you understand this important aspect. Suppose you are dealing with a chronic disorder where pitta and kapha is associated, so they are increased. Okay, so you want to decrease this pitta and kapha. No doubt kashaya rasa is the best drug, but you should remember that it also increases the vata. So if pitta and kapha is increased and vata is kshina in that patient, then kashaya rasa can be given. That quite useful. It means pitta and kapha is increased and vata is kshina, then kashaya rasa can be given because kashaya is pitta kapha hara, and meantime it is vata prakopaka. Similarly, if by kashaya rasa vata prakopa occurred, suppose after giving a kashaya rasa vata prakopa happened, then no doubt the disease will be very, very severe. Disease will be very, very severe. Therefore, this is one of the important aspects when you are treating the chronic disorders as far as Ayurveda. Okay, so in an attempt to decrease pitta and kapha, you should not increase the vata by using the kashaya rasa. You can use the kashaya rasa if vata is also kshira. Hence, in all the disorders which are chronic, always care should be taken to not vitiate the vata dosha. This is a simple take-home message. Okay. So whenever we are treating any of the chronic disorder may be related to GIT, may be related to neurological system, may be related to hormonal system, may be related to musculoskeletal system, rheumatic, whatever. But care should be taken that your effort should not increase the vata, because if it is increase the vata, the disease become more severe. Rule number one. Vata hara medicine. Vata hara medicine should be mild. So suppose vata is increased. Now we want to decrease the vata. So vata hara medicine should be mild so that pitta may not vitiate by increasing the ushna guna. This is another clue here, clause. You want to decrease the vata and you are prescribing the vata hara medicine. Okay. So your vata hara medicine should be in such a way that it should not increase pitta. Okay. Because when you are giving vata hara medicine to decrease the vata, pitta may not vitiate by increasing the ushna guna. So by meantime, the medicine should be mildly ushna so that kapha prakopa does not occur. See, it's a very, very tricky thing. Okay. So we are dealing with pitta and kapha dominant chronic disorder. We have to take the care of vata. Meantime, when you are giving the vata hara medicine, okay, in such a patient, vata is very kshina, therefore you are giving kashaya rasa, which is also vata prakopaka, no doubt. But in chronic disorder, whenever you are giving a vata hara medicine, Sometimes what happens, pitta may vitiate because of Ushna Guna. Therefore, they say that Vata Hara medicine should be mild so that it should not vitiate the pitta. But meantime, medicine should be mildly Ushna so that Kapha Prakopa does not occur. Another point. So, by considering all this, medicine should be neither too Shita, neither too Ushna, neither too, and Kapha Hara medicine should be given. Medicine should not be too much Shita, medicine should not be too much Ushna, and medicine should be basically Kapha Hara. So, that should be given. Now, use of the rasa in the treatment of the doshas. We know that Vata, the three doshas undergo Vriddhi, Kshaya and Prakopa like conditions, isn't it? So, in other words to say, they undergo Samatva, Vriddhi, Kshaya like conditions. So, like this, they can affect any part of the body to cause the disease. Okay, so Vata, the three doshas, they will undergo these three stages, Vriddhi, Kshaya and Prakopa. Otherwise, they will also undergo Samatva, Vriddhi and Kshaya. So they can affect any part of the body. Now, use of rasa in the treatment of the doshas. Katu rasa leads to one we have explained previously when you are prescribing the kashaya rasas, how care should be taken. Now, katu rasa leads to kapha shamana, but it vitiates the vata and as well as pitta. Point has to be kept in mind. Whenever you are going for administration of the katu rasa, kapha shamana will be definitely there, but meantime it will also vitiate vata and as well as pitta. When you are giving tikta rasa, that will definitely pitta kapha shamaka. Tikta rasa is pitta kapha shamaka, but it causes vata vitiation or vata prakopa. Tikta rasa always causes vata prakopa. Madhur rasa, that leads to vata pitta shamana. Madhur rasa, so that definitely leads to vata and as well as pitta shamana, but can cause kapha prakopa. Amla rasa leads to vata shamana, no doubt, Ushna Guna, everything is there, vata shamana, but it can cause kapha pitta prakopa. Lavana rasa leads to vata shamana, abhishandi, vatahara, but it can cause pitta kapha prakopa. Therefore, only katu can be used for shamanatva of the kapha. So when you look into all these things, katu rasa is very good for the shamanatva of the kapha, to do the shamana of the kapha, while vata shamana can be caused by amla and as well as lavana. So while tikta and kashaya are basically equal with respect to dosha shamana, therefore tikta and as well as kashaya. See, tikta rasa, katu rasa, tikta rasa, tikta rasa leads to pitta kapha shamana and as well as vata prakopa. Okay, same is the case with the kashaya rasa also. Previously we have discussed. Kashaya rasa also leads to vata prakopa and as well as kapha pitta shamana. Okay, so therefore in the shloka tatradyo maruti gnanti triktadayo kapham kashaya tikta maturam pitta manyetu kurvate. So while tikta and kashaya are basically equal with respect to dosha shamana, as both are pitta kafahara and vata prakopaka or vatahara, vatakara. Now, katu tikta kashaya is vatakara. Katu, tikta and kashaya, all the three are vatakara, and madura, amla and lavana are vatahara. We know that. Now, katu, amla, lavana is pittakara, whereas madura, tikta, kashaya is pitta hara. Katu, amla, lavana, so they are pittakara. Similarly, madura, tikta and kashaya, they are pitta hara. Madura, amla and lavana are sleshma or kapha hara, whereas katu, tikta, kashaya are kapha hara. Katu, tikta, kashaya are kapha hara. Madura, amla, lavana, they are sleshma kara basically sleshma kara, that's a mistake. Whereas, and katu, tikta, kashaya are kapha hara. And these three rasa which causes a vata vriddhi, any of these, so those three rasas which cause the vata vriddhi are basically kapha shamana, and those three rasas which cause kapha vriddhi are basically vata shamana. This point is very clear. Now, madura, amla and lavana basically contains snigdhatva and gurutva. Okay, now why madura, amla and lavana are basically, why they are vatahara? The reason is basically they contain snigdha guna and as well as guru guna. Therefore, they are vatahara. while Amla and Lavana, they contains Agneya Guna, both contains Agneya Guna and Ushna Guna. Amla and Lavana both are Agneya and having Ushna Guna, therefore they are Vata Hara, because Ushna is always Vata Hara. Now, Madhura Rasa along with Snigdha and Guru also contains Saumya Guna. Madhura Rasa along with the Snigdha and Guru Guna also contains Saumya Guna, because of which it is Kapha Kara. Because of which is Kapha Kara. While Amla and Lavana are having Ushna Guna, Agneya Guna, Amla and Lavana are having Ushna Guna, but they are Agneya in nature, therefore they also act as Pitta Kara. Okay, they act as Pitta Kara. Similarly, Tikta and Kashaya also contains Rukshatva and as well as Lagutva. So they are Kapha Hara. And Vata Vriddhikara. Because Ruksha and Lagutva is there, that is Vata Vriddhikara. Okay, because of same Ruksha and Lagu, they are Kapha Hara. So Tikta and Kashaya, now talking about Tikta and Kashaya, Rasa also contains Shita and Saumya Guna. Same Tikta and Kashaya Rasa also contains Shita and as well as Saumya Guna, therefore they are Pitta Hara. Now how Tikta and Kashaya is Pitta Hara? Because of Shita and Saumya Guna. How Tikta and Kashaya Rasa is Vata Kara? Because it contains Ruksha and Lagutva Guna. Okay, how Amla and Lavana are Pitta Kara? Because it is Ushna and Agneya Guna. How Madhura Rasa is Kapha Kara? Because of Snigdha, Guru and as well as Saumya Guna. Okay, so these are some of the important points that we have to keep in mind. Okay, so when you are dealing the rasas. Now, Katu Rasa contains Ruksha and Lagu Guna, which is Vatakara, no doubt. Katu Rasa contains Ruksha and Lagu Guna, therefore it is Vatakara. Katu Rasa also contains Ushna and Tikshna Guna, because of which it is Vatahara. Because Ushna is always Vatahara. It also contains Ushna and Tikshna Katu Rasa, therefore it is Vatahara. So therefore, Katu Rasa is both Vatakara and as well as Vatahara. Now accordingly we have to use this property by looking at the Guna dominance, which Guna is increased. Therefore, Katu Rasa strengthens the movement of the Vata because it is Vatakara and its pathway by removing the obstruction in the path. While administering the Vata Hara Kashaya for conditions for increasing the Kapha, now you are administering Vata Hara Kashayas for conditions for increasing the Kapha by Madhura, Amla, Lavana Rasa drugs if the Kapha Vriddhi occurred. So then in such conditions, in Vata Hara Kashaya, that means Vata Hara Kashaya should be added. So I hope you got it. While administering the Vata Hara Kashaya for conditions where there is increased Kapha. Why that increased Kapha happened? That is because of intake of Madhura, Amla and Lavana. Maybe in the diet, maybe in the drugs itself, yoga itself. Okay. So although you are giving a Vata Hara Kashaya, it increases the Kapha. In such conditions, Kapha Vriddhi will occur, and that Kapha Vriddhi, how you have to tackle it. In such conditions, Vatahara Kashaya should be added with the Shunti, etc. Katu Rasa drugs to prevent the excess Kapha vitiation or Kapha Vriddhi. If there is a risk of Pitta Prakopa, then Pipali should be added, Anushna Shita. And if there is a Daha and Chosha of the Pitta, then Jiraka should be added. Many times by adding Katu Rasa Yukta Maricha, the Vatahara property is attained. Katu Rasa Yukta Maricha, the Vatahara property will be attained. Okay, so these are some of the important things about the rasas which we have to keep in mind, especially when you are treating the chronic disorders. Usually what happens in the chronic disorder is there is involvement of all the three doshas. If the disease is very new one, then either single or double dosha vitiation will be there. Okay, so we can plan the treatment accordingly. But when you are talking about chronic disorders, almost all the three doshas are vitiated in such condition. So then there should not be paraspara viruddha. So therefore, while using the rasas, so we need to be little careful. So with this I conclude for today. Thank you very much. In the next class we will continue the same. Thank you very much. Don't forget to subscribe to my channel and also please give your valuable comments. Thank you very much.